New York City, bustling with life, energy, and rats. That's right. In the heart of the Big Apple, alongside the towering skyscrapers and bustling streets, a silent epidemic brews. An alarming increase in cases of leptospirosis, a rare disease linked to rat urine, has been observed among New York City's sanitation workers. In the year 2023 alone, there were 24 reported cases, marking the highest in any year. And the clock is ticking in 2024, with 6 cases already reported by April. Leptospirosis, quite a mouthful, isn't it? But what exactly is this disease? Originating from the spirochete bacteria Leptospira interrogans, leptospirosis is an infectious illness spread through rat urine. It's not just rats, though. This disease can come from other animals too, but our prime suspects in New York City are its infamous rodent residents. Now, this isn't your typical flu. Leptospirosis can lead to severe symptoms such as kidney and liver failure, respiratory problems, and death. And it's not always easy to spot. Initial symptoms can range from fever and headache to diarrhea and jaundice. It's a sneaky enemy, often mistaken for other illnesses. So, what's the plan of action if someone contracts leptospirosis? Early diagnosis and treatment with antibiotics are crucial. The battle against leptospirosis begins in a lab with tests conducted to identify the presence of the bacteria, and time is of the essence. The sooner the treatment starts, the better the chances for a full recovery. But wouldn't it be better to prevent the disease in the first place? Absolutely. And that's where the fight gets interesting. To tackle the city's rat problem, New York has appointed its first ever rat czar, Kathleen Corradi. She leads the charge in reducing rat populations, promoting cleaner streets, and educating the public and at-risk workers about preventive measures. These include wearing gloves and avoiding direct contact with rat urine. Yet, despite these efforts, leptospirosis cases continue to rise. Health officials attribute the increase to warmer and wetter weather conditions, creating a more hospitable environment for the survival of the bacteria causing leptospirosis. Summarizing what we have so far, leptospirosis, a disease linked to rat urine, is rising in New York City. Sanitation workers are particularly at risk. Symptoms can be severe, but early diagnosis and treatment can lead to recovery. Measures are in place to combat the city's rat problem and prevent the spread of the disease. But leptospirosis remains a challenging adversary. The better educated we are about the disease, the better equipped we are to combat it. Leptospirosis may sound unfamiliar to many, but it is a disease that poses a real threat to our community. Let's dive deeper into understanding this silent predator. Leptospirosis is an infection caused by Leptospira bacteria, often found in rat urine. The bacteria can enter the human body through cuts in the skin or through the mucous membranes of the eyes, nose, and mouth. The early signs of leptospirosis can often be mistaken for a simple flu. Symptoms such as fever, headache, chills, muscle aches, vomiting, or diarrhea may appear. However, in severe cases, the disease can lead to kidney damage, meningitis, liver failure, and respiratory distress. If you suspect that you or someone else might have contracted leptospirosis, it is crucial to seek medical attention immediately. Treatment usually involves antibiotics and supportive care to manage symptoms. The earlier the treatment starts, the better the chances of recovery. Prevention is always better than cure. Controlling the rat population is key to minimizing the risk of leptospirosis transmission. This involves proper waste management, sealing off potential rat entry points in buildings, and using rat traps or poison. However, the fight against leptospirosis is not just an individual battle. It is a community effort. Raising awareness about the dangers of leptospirosis, educating people on how to protect themselves, and implementing effective rate control strategies collectively can make a big difference. Stay informed and protect yourself and your loved ones from this potentially deadly disease. Remember, knowledge is power. The more we know about leptospirosis, the better equipped we are to keep our communities safe.